Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show. Hey everyone, thanks for hanging out with us today. I'm Signe, one of your hosts.
Hi, and I am Sandy Newest, your other host.
And we're getting on today to do something a little bit different. As you guys know, if you've been listening to our podcast so far, over our careers, we've interviewed quite a few experts in the research space, the policy space, other important areas of psychedelics. But what we really want to talk to you guys about today are the kind of things you've been asking us for, which is how to get into this field, like what to know. In other words, a lot of people approach us and say, what is it that I need to know that I don't know? Do I really need to do this or that thing that I've been told I need to do? How did you guys get started? How do you coach or mentor people into getting started? And these kind of questions. So we have started this podcast really to talk to you guys, those of you out there who are clinicians, whether you're therapists or medical providers or other adjacent specialties, who want to get into psychedelic work using ketamine, legal ketamine-assisted psychotherapy in clinical settings. And you guys have a lot of questions. There's not a clear pathway out there, even though there's a lot of great resources. So we're here today to just talk a little more informally about things that we wish we had known or things we think that you guys might need to know. So let's just think through the kinds of things we tend to get asked. Sandy, what do you think, like who's the typical trainees that we see or the typical person that comes in, given that we've been doing this for about 2 years?
Yeah. I mean, it's a wide range. So I I do the initial interviews, initial meetings with people who do the inquiries, and we have two tracks. There's the clinical professionals, and then there's the medical professionals. At our program, it's mostly licensed or license eligible people. So that kind of brings in kind of that in and of itself is a bit of a gatekeeper. And it is very much people who are aware of the psychedelic movement, if we're going to call it that, the kind of the publicity, the research, they're aware of it. They're tracking it. They're confused by it. They're intrigued by it. And they're wondering about how to get in on it. So that's kind of one of the tracks. Like, I'm aware of this. What is this? How do I learn about it? Tell me more about it. It seems like you guys are experienced at this. Kind of tell us about it. That's the one track. Then there's the other track of people, again, professionals who have really had profound psychedelic experiences of their own. And maybe they read Michael Pollan's book or saw the series and they're like, whoa. And, maybe they were called to this by their, by the publicity, and they got into it often kind of later in life. And they see the power of it for themselves. And then they'd like to apply that in their career. And then the third track is really people who already know that they want to do this. And maybe they've already had some education, maybe that it didn't quite meet their need for direct clinical application. Like, how do we do it? Like, I've learned about this, I've read about it, maybe I've done some other trainings, but I want to know how to do it. And I'm ready to incorporate this into my practice or into my clinic. And I'm ready to go. So it's the kind of like general people who are aware and unclear how to get into it. They're looking for that clear pathway. They're looking for people to teach them and to mentor them. There's the people who've had their own experiences and see that this is profound and impactful. And then there's the people who actually know about it, but are just unclear about how to get from where they are to how to actually begin to see clients or to begin to put that into their clinics. And those three pathways are ultimately related, but those are kind of the three areas that people most identify with, I think.
Yeah, and I think that actually is probably who a lot of our audiences we're finding. So our intention is to try to be useful to you guys and answering some of these questions. What are the things that you think people are most stumbling up against? Like, what are the stumbling blocks out there that people come in when they do their interviews with you and say, this is what I'm missing, or this is where I'm getting stuck? Why aren't people launching into careers, in other words, as easily as they hope to?
Hmm. Um, well, initially up until the summer when there were regulatory things that sort of backburnered some of the things around MDMA and psilocybin, um, there was a lot of questions about the utility of ketamine and ketamine versus other medicines, and that's its own separate conversation. But the bottom line with that is when I begin to assure people that it's very effective, it's totally legal, and it's actually really fairly simple to incorporate into a clinical practice in terms of like timing of sessions, and you can do 2-hour sessions and get people in, and that helps with scheduling, and the arc of the medicine is pretty predictable. People don't know that. Like, they don't understand about ketamine that it's actually really straightforward, and
Yeah.
that you learn it and you can do it and it fits into like a regular office practice, as opposed to other medicines that require a lot more time and energy and just aren't legal. Like energy meaning like a 6-hour session or something like that, and a lot of like getting off of meds, and but ketamine is 100% legal. It's never been illegal. And so when people come to understand that part, that kind of opens up a lot of doorways for them to see it. um and and then there's the piece about just like, okay, I'm a solid professional. Like, more people who come to this who are like further along in their careers. It's not, there are a percentage of people who are brand new and have been just kind of tracking this and maybe even went to school for this. But a lot of people are further along in their career. They're maybe bored, they're maybe burned out. They see that there could be something different. They've had glimmers that something, there are other tools that psychedelics can provide that might really help them deepen more quickly into change with clients. And so they're intrigued by that. And they also want to make sure that they're doing it well. Like, one of the weird parts about ketamine is it's totally unregulated. So anybody can technically do it. Like, a medical provider can do it who's able to prescribe and can get that license for controlled substance. And you would know more about that than I do specifically. But then on the clinical side, people want to be ethical. They want to do the right thing. They want to make sure that they're not just jumping in and don't know what they're doing. So in a way, that can almost be a block. And, in our training, what we're trying to do is just be like, we're going to help you do that. Like, we're going to help you get from being an established professional who knows like how to do good clinical work, who knows how to serve patients. And we're going to give you a skill set. We're going to help you practice. We're going to help you learn about the medicine so that you're going to be fully ready to at least begin the process and to feel confident that you have the skills to do it.
Yeah, I've noticed similar to that what a lot of people don't have is like a vision of how they can do it. We
Yeah.
talk a lot to people that come to us. So like, I want to do this. I don't kind of see exactly how, like what my path forward is. And also, we are so used to, as professionals, going through training programs and certifications and things, licensing, where we're sort of given permission to do something in an established track. And, that doesn't exist yet in this world. So how do you, exactly like you said, how do you make sure you're doing it safely, ethically, and appropriately when there's not a really obvious person to ask? And so I feel like a lot of those questions, we often are fielding a lot of that with our trainees. And really what they're asking is, how did you guys do it? And how did you figure out how to do it safely and ethically? And because you and I have our eye on the sort of the broader practice community out there, what are the standards that are out there, and being able to answer people about things like that. Um, but there's not a vision. And then I also feel like there's almost like a confidence hurdle, which you spoke to a little bit, which is, this is a weird and different. And we get a lot of people that have gone through other trainings or done online trainings, and they know a lot about it, but that's not the same as knowing how to do it in the moment. So you and I have talked a lot about this, how, trainings really need to have a lot of focus on actual practical nuts and bolts clinical skills. So a lot of you out there listening, you may find yourself in this position of like, I might have an opportunity to even do this work. I might even have clients that are interested, and already a good therapist or a good clinician. And yet I'm still a little nervous. Like I keep not stepping into it because I'm not exactly sure what to do once I'm in the room on the medicine with the person on the medicine. And so we really, we understand that that's kind of emotional and logistic hurdle that a lot of people are looking for mentoring and actual just like practical advice on, that we have found. And so we focus a lot on that kind of thing because that's understandable. This is new, and you there's not a there's not a lot of people to look to in your immediate community for most of you who are doing this. So
Right. Well, and it's interesting because one of the things that I kind of tell people that I think is kind of funny, but it is so true. Like, when I first started doing psychotherapy, like, where do you put your hens? It starts to be analogous to that. Or when you learn about like psychological theory and you're busy in your head trying to figure out, like, okay, what's the next step? Right? What's the next thing I'm supposed to do? And there is a little bit of that, but that's also for people who are established professionals. That's also a place of insecurity, I think it's so important for people to really know their own strengths as a clinician coming in and to really, like, one of the pieces of advice you gave me, like, for our listeners who don't know, I mean, Signy ultimately trained me. Like, that's where we started and, began to work at the clinic that she and her husband founded. And I did a deep dive. I'm going to do as much of this as I can to get to learn as much as I can, as quickly as I can. And I did. So, I very much lived that with you all. And so, like, knowing that, like, there's an awkwardness to it and that you have to figure out the groove and that's just part of doing anything new.
yeah.
Like, it's really more like it's just like a novel setting. Um,
Yeah.
you
Yeah.
know,
I don't know what you think. You probably agree, but my experience with the many trainee cohorts that you and I have taught at this point with LMI is the things that they really desperately want, and understandably, is what do I actually do? Like in a really granular kind of detailed way. Like if this happens, do this. If this happens, say this. If this, then this. And almost like simplified down, at least in the beginning, until you kind of get your feet under you. And that sort of like, overt, providing kind of like a, what is that? Like not a landing strip, but like a launch ramp into the work that's really, really accessible.
yeah.
And then the fact that we show videos and they get to see a lot of sessions and see what it looks like, people are really hungry for that because that gives them a vision for themselves doing it and something to template after. And I think, I went through residency training as a psychiatrist, and you did something similar where you kind of have people to model on. And that's, I think, what's missing a lot in this space, which is why people are really drawn to having filmed sessions or having us sort of, role play and walk through what it actually looks like. Um, which actually then gets into the importance of having your own sessions. That's a whole nother topic that we can definitely talk about, but it's worth dropping in there. If you are listening and you are interested in this work and you have not experienced the medicine that you want to work with, in this case, ketamine, then, we have a lot of thoughts on that, but it's a huge part of your learning. It's a huge part of your learning for kind of conceptualizing what's going on in the inner world of your client.
But plus, it's interesting, like we
Yeah.
see over and over again that people who come through our training program, we do a fair amount of medicine in our training program, and we think it's an essential part of training, but it's also personally impactful. Like, people come out, they're like, oh, wow, like that impacted me as a human and not just a professional.
Yeah,
And
absolutely.
these professions, those things are linked. So yeah.
What do you and not, I haven't shared these questions with you ahead of time. We just decided to get one in our living rooms and just chat. So we haven't really, this is not a formally thought through interview, but I'm actually curious, like, what do you think surprises people the most? Like having run the retreats or the trainings we do that you think, people come in with an expectation and then find out otherwise.
Oh, there's a lot of them. One of them is that ketamine itself is way more powerful than they think it's going to be.
Yeah.
Like, people come in with a lot of biases towards plant medicines and things like that. And having been a person who has also been down those roads and has a shifting, perspective on that over time, I can appreciate that. But people are really blown away by just how powerful a ketamine experience can be for them personally, and then how much they see it impacts their clients. So, I mean,
Yeah, I
that's the
think,
biggest one. Like, whoa, I
yeah,
had
that's
no
a big one.
idea.
And you and I, if we back up our lives enough, we both had that experience at some point ourselves, right? Coming out of plant medicine world and moving into ketamine. So we can relate. And
Yeah.
yeah, I agree. So many people come to us and say that. Almost like like most people. it feels like say that to us.
Yeah.
They were
Yeah.
caught off guard by, it being as potent as more than less than there's that bias you named that it's not quite as potent as the quote classic psychedelics or MDMA.
Yeah. And I think another one is I have two actually just off the top of my head, but another one is the really important realization that the medicine session is only one part of it. That really skilled preparation and integration of which the medicine session is embedded in
Hmm.
is that those things are they are the process, and that's really what differentiates ketamine treatment alone, where you're just at a med clinic and doing it or doing it at home by yourself or however your administration is, from CAP, is that really skilled preparation, integration, and with the medicine session being, a piece of that, but those two parts being equally, if not more important.
Yeah. Yeah. Those are very true. I would echo those.
Yeah.
I
And
feel like
that,
another one that comes up that we need to do a separate podcast on probably is how much like a lot of our trainees are surprised by how much trauma content comes up and is processed in other words, we often get our trainees who are skilled clinicians and already working with trauma in their practices saying, "Oh my gosh, I had no idea how good this was for trauma because of what they learned by going through the training process or experiencing it or starting to use it." That can be a whole podcast in and of itself.
yeah.
That's one that I feel like surprises people.
Oh, for sure. Because the prevailing view out there is that it's not good for trauma. And I would say for people, who just go into a straight ketamine clinic and do it without a therapist or without even an integration support or preparation and integration, some people still have great results. I've talked to them. But some people do not, or they just don't have a lasting result. And, a lot of treatment resistant depression, if you scratch the surface, is really related to complex trauma and PTSD. And so, a lot of what we're working with really comes down to that. Now, I have a bias towards that because I see everything from that perspective. So I have to own that. I'm, one of those people that's like everything is trauma because of how it impacts your brain and your nervous system. But, and then this realization that like, oh, if you're already working with trauma, like you're going to be doing trauma work and
Mhm.
you're simply be applying the skill set that you already have into this novel and an experiential way. Like, because really it's an experientially oriented intervention where somebody goes into a non-ordinary state. But you could make the argument that that happens in wilderness or mindfulness or rites of passage or vision quest. There's a lot of non-medicine ways that people go into non-ordinary states. So we're just applying skill. We're doing some new skills, but we're also applying the skill sets that people already have through an experiential lens with non-ordinary state work.
Yeah. Yeah, you're not going to be doing this work the way I do or the way you do, Sandy, or the way, each person that comes through ends up doing it the way they do it. But we do really emphasize particular skills that are important, that are universal. And also there are some concerns that are universal. So maybe we should talk a little bit about that. I think one thing before we move into maybe concerns that we both have that we want the audience to just be aware of, whether you come through our training program or you're just going to, find a pathway through another program out there. Um, but I wanted to name one other surprise that I feel like people have, and that is that they can actually do it. Like I feel like that moment at the end where they start seeing clients and they like we always get them coming back kind of like, oh my gosh, it's going well, or I did this session and it was so great. And they, because I think people are surprised to find out that they have it within them to do this work really well once they are literally just given the pathway and given the mentoring and the specific how-tos. Um, and that's just a really lovely moment. I love it because I see people's confidence shift. They go from like, I don't know, I don't know if I'm qualified, I don't know, to going like, I am called into this work and I can step into this work with authority and I am doing good work. And I just love to see people make that shift. And so I think to the listeners, I would say you guys can make that shift, whether it's with us or another good training program. Um, if that's where your hurdle is, definitely like take the journey, take the risk, take the step into like shifting this into your career. It definitely is a growing part of mental health. It is the frontier. And Sandy and I can attest to the fact that it is really exciting and interesting. And you can do it.
Yeah,
And of
totally.
course, the other side of that is like, you do need to hold this safely. So maybe we should say a little bit about what are some of the concerns that we see out there.
Mhm. Great. I mean, the biggest concern that I have is the fact that ketamine is unregulated. So anybody can do it. And why that's of concern is that there's a lot of people doing it who I think don't know what they don't know. So, like, for example, like there's this interchangeable language around like what is ketamine assisted psychotherapy versus ketamine treatment versus ketamine therapy. And that's one of the places that I educate people right off the bat is, there are really significant differences, but we don't have any standardization of language. So, because we don't have standardization of language, we also don't have consensus on what one might expect in different settings. And so, you know, and we also, you don't have as a consumer, you don't have an assurance that somebody knows what they're doing. And a lot of ketamine clinics that don't have therapists at all make very sweeping statements about the fact that they work with a whole range of mental health issues. Um, and, while you might have a pharmaceutical benefit or the experience that yourself might have might help you in those therapeutic domains, like if you're not doing CAP, you're not necessarily working specifically on mental health issues. So that then becomes reflective of the lack of standardization. Like, I'm sure there are wonderful anesthesiologists doing this work in really lovely ways and that are really helping people to change. But to say that you're directly working on, PTSD or generalized anxiety may or may not, that might be more of an indirect effect as opposed to a direct effect. And so I get concerned about that. And that's not to put down the clinics or the anesthesiologists just because I said that, but the lack of regulation and the lack of like need for training or identification of that as even a need sort of implies as if there's not that much to learn when there really is. And then to do it, next level, to do it safely and to do it well, and to really, make sure that you're really elevating your clients' outcomes and taking really good care of them while also taking care of yourself is really important because this is also really demanding work. It's interesting, but it's energetically very demanding because you're really in it with the client.
Mhm. Yeah, it takes some self-care and some doing your own work on your own stuff to be able to hold this kind of container for someone else.
Yeah.
Yeah, I would another concern I have, which is related, but maybe in a slightly different words, is really for you guys who are listening, is it is possible to do harm with this kind of intervention. So ketamine-assisted psychotherapy, as with psychedelic-assisted psychotherapy in general, this being a subtype of that, can harm people if done badly. And I think that is not said often enough. We just did an interview with Derek Ronaldo specifically on this topic. So I encourage you guys to check that out. But those of us who do this work on the ground in full time, like Sandy and I, day in and day out for many, many years, you see cases of harm. And we also see people who've been harmed in other settings coming to us and telling those stories. And so I put that out there because I really, we feel ethically that, speaking to you guys as listeners, some of you may be ready to do this and some of you may not until you get more training, especially around safety. So please don't step into doing this work unless you're really clear that you've been trained by somebody who's taught you how to track for ways people can be harmed and also what to do when that happens. A lot of times, in cases like that, the provider is left not knowing what to do about it. I think that's happening quite often. So, I feel like our ethos, and I know, Sandy and you and I talk about this a lot, is we want people to have nuts and bolts skills. We want to mentor them into the work and encourage them and let them know you can do this. But we also we want to be really careful and not cavalierly saying, "Hey, everybody, let's just jump right into this. Let's all do this." It's not that at all. It's actually check yourself very carefully and be very careful about how prepared you are from a safety sense. So it's like that balancing act. Like we want you to feel motivated and we want to encourage you to do this. And we want you to not just assume that you can jump right into it without being thoroughly prepared for how to anticipate harm and then how to how to handle that when it does happen. And also to some degrees, even recognize it. There's a kind of shocking lack of awareness out there in the kind of population at large right now about how harmful psychedelic experiences can be if handled poorly. I think the media underreports that aspect of it. And so even trainees come in with a bias, like, oh, this is just going to help everybody, full stop. And you and I talk about a lot how that's not this is not a one and done, all, fix all kind of intervention, way more nuanced, takes a lot of work on the part of the therapist and the client.
Right.
And it can be rocky. And both your own self, you need to be able to hold that risk tolerance and know how to handle challenging situations and how to like show up for your client when that happens and not just, be overwhelmed by it. So, make sure if you're going into this field that you find a training program or a mentor who can fully prepare you for this piece.
I want to put a little structure on that. I'm curious if you agree with this. I think that there are kind of three broad areas where harm can be done. One is when people it opens up content that they are unprepared for and that they don't have the support in doing, and they don't have the relationship with the provider, whether that be just the medical team at a clinic or, even a therapist, that they don't have the relationship and they don't have that trust and skill set and the capacity to navigate that. Now, that's kind of analogous to psychotherapy, but it is important. But it doesn't always happen. People think that this intervention is so much about content, and that's only one of the ways. Another way is the kind of transpersonal way, like it can open up sort of an awareness or a questioning or a curiosity or even direct lived experience of relationship with, we can call it the other world, we can call it religion, we can call it spirits, we can call it transpersonal, we can call it mystical, we can call it a lot of things. But this kind of what is this? Kind of like, oh, now we've seen things that can't be unseen. Now, does that always happen? Absolutely not. But can it happen? Certainly. And then without kind of a place to land in that, that can be really difficult. And then the third one I would just put into a broad category of relational. Like, people don't realize how much of a relational intervention this is. And that plays itself out in not only skills, but energetically. Like, you're in the bubble with these clients. Like, we are right next to them during the medicine. We are with them.
Very intimate.
Very, very intimate, and it requires a very high degree of trust on the part of clients. And for some people, especially those with complex trauma or relational trauma, are going to come in with a high level of hypervigilance. Mm-hmm. So recognizing that this creating safety, not just like physical safety and medical safety, but relational safety.
Yeah.
And to recognize just how vulnerable somebody is and how their brains are in a different state. And this kind of like imprinting can happen. So they can be, deeply moved, but also very scared or hurt or left uneasy, that can then generalize outside of the medicine session to the rest of their lives. So there's a huge responsibility to manage your own energy as a provider and to be really, really careful with how you engage with the client, and to hold that with such honoring of the trust that is put, in you, to have somebody allow themselves to move into that space with you. And the same goes for our training program. Like, we're acutely aware of that. And that's the beauty. I think that's really one of the like less spoken, beautiful aspects of this work, but it's also one of the dangers.
Yeah, that's very well said.
Yeah, there's the content, there's the transpersonal piece, and then there's the relational piece. And those are really the areas that I see the harm. And just, always have to be spoken the fact that, the more widespread use of ketamine there is, the more also therapeutically, the more widespread use there is recreationally. Those things are paralleling each other. And we do see addiction. Like, overuse of ketamine is bad. Like, don't overuse it. Like, just because you have a therapeutic experience does not mean you should go get some and then use it a bunch all the time. That is going to have an adverse effect. And that is called addiction or substance abuse. That's not called seeking more therapeutic experience. Like, so we should always have to name that.
Yeah. Yeah. That's you speaking to a phenomenon that's out there where the fact that ketamine is now being recognized as therapeutic and a psychedelic therapeutic, it can be there can be a slide among people to go, well, I'll just do that on myself, and that's a very slippery slope. So we definitely would put up big stop sign for that one. Um, and yeah, the relational piece you spoke to is very important because we recognize that you guys as listeners are already, many of you, trained and very skilled clinicians. Many of you are therapists, and you understand boundaries, and you understand, transference and how to hold the relationship, a therapeutic relationship, in a healthy way. Um, but what Sandy's speaking to is correct in that this is different. This is a more vulnerable situation because your client's usual guards and defenses are in some ways taken away from them on a psychedelic. And so if you don't know what I mean by that, and some of what Sandy's saying sounds like, oh, that's interesting, but I'm not sure exactly what she means, then we would really encourage you to get more supervision or mentoring or training around these pieces. Because exactly as Sandy said, this is where a lot of harm can be done. So I'm glad that you were able to put that into a little bit more of a like a checklist of three things to make sure you're tracking
Well, and
in the
it's
harm
interesting
domain.
because as we say that, I'm also like, and also those same things, that like double-edged sword thing are also probably the things that differentiate this the most from a traditional psychotherapy intervention too, is the fact that those aspects are different,
Yep.
uh, and are a big piece of holding those levels of awareness and the things that might really differentiate that, like what the benefit of the non-ordinary state is, the benefit of the medicine session comes in excuse me, some of those places. So it's like learning to work with that and not do harm, but also then to utilize those elements is probably also the skill set, really, if we think about it.
Yep. Yeah, I think it's a good meta statement. Like those of you listening who want to get into this field, one, we've said you can do this. If you know that you're a skilled therapist, you can definitely do this. There's a pathway and it is very doable. And most of our graduates go straight into practice in their existing practices or in new collaborations. So we know that for a fact. And you will be working with your own new skills and your own like gaining confidence or increasing confidence. We know that because we've seen that play out over and over again. And it's going to work. And part of that journey will be you learning these safety pieces that Sandy and I have talked about. Whether you do that with us, or somewhere else, and if you do it with someone else, just make sure you do it, and that you have kind of thought through all the points that Sandy just made. With, am I sure that I know how to hold those boundaries that way? Am I sure that I understand how to create a relational container that is appropriate for someone in an altered state? So when you hear me say these things, if you have a little bit of like, I'm not sure what that actually is, then that would be a place to get a little bit more instruction and mentoring, because your primary responsibility is to do no harm and to do this in the safest way possible. Um, it is a new frontier. It is an evolving field. Things may be different in 5 years than they are now. So those of us who are doing it now are at the forefront of something. And, we're in many ways collectively learning as we go. And I'm sure that will continue to be a thing. But so the foundation of all of that has to be the safety, and doing it in a safe way.
Mhm.
So before we take off for today, I thought that maybe you and I could just say on a personal level, what kind of moves us about this work, what it's like being in this work. And I can go first. You can go first. I don't know.
Well,
You
let
have
me I want to add one piece to what you just said too about if if you're interested, but you're like, oh, wait a minute, I never came from plant medicine, or I'm actually brand new to this. Awesome. Because that is a lot of the people that we work with have either not had any experience with any psychedelic medicines or have had very little. So that is not a requirement. Some have not, but just know that we actually offer that. That's one of the things that we want to provide for people through with ketamine. So don't
I
let
mean,
that be.
most providers that are going to get into the legal, clinical ketamine-assisted psychotherapy world, just realistically, are going to come out of a kind of like Western trained, already existing therapists who are licensed providers in the sense of like where the field is probably going.
Yeah.
So you having had underground experience might be interesting to you and part of your personal journey, but not really relevant to what you need to get trained because you have a legal psychedelic in ketamine that you can experience as part of your training.
Yeah.
And that is an extremely important part of your training that we didn't really touch on today. Um, but that, discovering yourself on a psychedelic, like who are you when you're in an altered state, is a huge part of your learning. And,
Mhm.
in our community, we obviously do that by giving you many, many ketamine sessions of varying types and kinds to kind of really, get you to a place where you go, okay, I know what this is. I know what it is to navigate this state. But it doesn't require you, as Sandy said, to have a pre-existing experience with other medicines coming in. Um, in some ways, ketamine is the medicine that you need to sort of, in the traditional underground world, there's the phrase get in relationship with the medicine. Well, this is the one you need to get in relationship with if it's the one you're going to be using in your practice.
Yeah. Great. I love that. So what was your question again?
Oh, yeah. I
What's the
thought it
best
would
part
be
of this
fun.
year? Was that it?
Well, we never really get to ask each other this, so I thought it'd be fun. It's like, what do you find the most moving or compelling about this whole world? Like the fact that you find yourself as somehow a psychedelic medicine expert, right? Neither of us knew in training that that's what we were going to end up being. Like, what is that like?
Oh, that's an interesting question. So there's a lot to that for me. One of them is that, this again is not everybody's journey, but there are a subset of us that, my work with non-ordinary states is one of the most impactful things in my life. And that is a broad construct, not just medicine, but a lot. And I know that. And I have known that for a long time. So my career has essentially been a lot about exploration of non-ordinary states. So to be able to land in this just feels somewhat led, and very mission driven. So there's a deep gratification about for me about bringing together a lot of my life experience and who I am as a person with my professional training that feels like a weaving together that is deeply, deeply gratifying for me. Um, but the doing the work piece, so that's about being able to do the work, which I'm eternally grateful. And I'm grateful to you too for opening, being one of the portals to that, really. But doing the work with the clients and in the training is about who I get to be as a human. So, and then who that allows the clients to be as a human. Like it's a full, like a full kind of holistic experiential intervention. Like, we're living life, we're having these experiences, and then we're using the experiences and who we are and living our life and as humans to look at what comes up around that and then process it and explore it and then ground it into actual real life. So even though a medicine session might not seem like real life, we do a lot of work with this parallel process concept, which is how is what's coming up and what, directly associated with what's going on for you in your life, which is also another separate conversation. But kind of like being able to be authentically in relationship while tracking what's coming up around that by being able to be very intimate and really be working with that aspect. And for me to be able to show up in my most authentic, yet also professionally aware and intentionally presented self, presented, that means being aware of the things that are coming up around the relationship, is just so human. And then to also, I say this a lot in training, but like, it's also really an opportunity to be deeply caring. And if nurturing is a part of, who you are, like we get to be caring and real and nurturing and be nice. That sounds so weird. Like, well, we get to be really nice to people. But what I mean by that is to be able to,
Loving. Feel like you're almost saying loving. It's not a
yeah,
word we
I
often
mean,
use.
yes,
Yeah.
we get to be loving and sweet but while also then just very intentionally tracking what's coming up around that. Like I was in tears with a client the other day, kind of talking about the storm and the impact of that. Now that happens for me in regular sessions too, because I actually think that's just part of being a real human. Um, But those kinds of things happen a lot. So we're really just in it on a human level while also really holding that professional awareness and utilizing those relational things with intention. And then this honoring of all the different aspects that can come up, including transpersonal, is just really, that to me is the best part.
Yeah, it's therapy, and we're using our therapy skills, and we're being providers, and these we're in offices and all these familiar things, and yet there is something about it that just feels more real
Hmm.
almost
Yeah.
than non-psychedelic work.
And so and people who are sitting there being like, and yeah, that may be some or not who are like, oh my God, what do you mean? I have to be all sweet and nurturing to the clients? That seems weird. Also know that these are direct parallels to experiential approaches to therapy, somatic approaches to therapy, relationally oriented psychodynamic. Like my, PhD work was grounded in an interpersonally oriented psychodynamic model. Like I can language it from that perspective super easily. Like we're also doing theoretically grounded, you know, technique oriented psychotherapy too. Like, so, and that's where I think the interest, like the acute interest lies, is this intersection of
Yeah, I
all the,
think that's also why so many of our graduates have come out realizing that they can do it because they
yeah,
already have these amazing skills and they just have to learn how to use them in a new context. Yeah.
yeah.
Well, I think I was thinking about my answer for this because I decided, I wasn't sure if I'd ever answered it either, but and I've never really answered it this way, but honestly, my answer is I think a lot of us as children have this sense of magic, like the world has a sort of magic to it. And that's true for me as well. And then we grow up and become very learned and educated science-based professionals, and evidence-based and in the medical system. And there is a sense that like everything is just treatment for suffering follows an algorithm, and we're taught the algorithm, right? And there's no mystery to it. And I think with this work, it almost is like I'm still a professional and I'm still working in a clinic and I'm using my medical license and I'm still in that world. But sometimes I'm sitting in these sessions with people and it's like that sense of mystery and magic is back at the same time. And I find that really compelling and kind of emotional. So
Mm.
I think that would be my actual answer. And it's probably part of why, similar to you, I feel like I probably have a certain call to be there. And I would say that a lot of you listening, we know that you have that call because you guys have been coming to our training programs. And I think there's something that pulls people into doing this that is a resonance there, with it is doing mental health treatment. And also there's something like sacred space that arrives. It's not that I created or I am it. It just arrives when someone is in these kind of altered states. And that intersection is really potent and not something that I ever expected to be able to do in my career, just going into psychiatry back in the day. So I think we can end on the fact that there are skills, you guys can learn them. There are safety pieces, you guys must learn them. And then there is mystery and magic, and none of us know what that's about, but we are all just here, reflecting it back and just honoring that that's there.
Yeah, like staying in the inquiry with it is a phrase I like. Like we're in this inquiry with the mystery and the magic that is informed by everything else that we bring to the table.
So thank you guys for tuning in. We're going to start doing a lot more episodes with sort of questions that the audience is asking that is kind of hopefully practically useful for those of you stepping into this field. That's our intention. And we have one coming up, just kind of debating ketamine for trauma. So keep your eye out for that. And we will see you soon. So
All
thank you,
right.
everybody. Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.